Before November of 2015, an RNA virus of the Flaviviridae family, better known as the Zika virus, was a relatively unknown viral pathogen, generating a small amount of attention compared to other popular diseases such as influenza and Ebola. Typical symptoms of being infected include rashes and mild joint pain. The infection lasts for about a week, but superficial symptoms are very rare. Transmitted by the Aedes species of mosquitoes, the Zika virus causes a notably mild infection compared to other serious pathogens that are similar, such as the dengue and chikungunya virus. The mildness of the symptoms and low infection rate have allowed the Zika virus to slip under the radar of most scientists, but today, thousands of cases have put Zika on the agenda of the international community. In 1947, scientists were performing research on a rhesus monkey from the Zika forest in Uganda to further understand yellow fever and its effects. The monkey later developed a fever, which was later identified to be the first form of the Zika virus. Zika was also found in the Aedes africanus mosquito, the largest agent of transmission to date. In 1954, the Zika virus had infected its first human victim, a Nigerian man. From its discovery till 2007, there are a few confirmed cases of the Zika virus from Africa and Southeast Asia. Soon, a major epidemic arose in the Yap Island of Micronesia. Recently, epidemics have occurred in Polynesia, Easter Island, the Cook Islands, and New Caledonia. The most recent outbreak of Zika outside of Africa and Southeast Asia was in Brazil in April 2015. The outbreak was linked to the increased flow of foreign visitors, especially those coming from infected countries. This increase in foreigners was prompted by the 2015 FIFA World Cup. The disease spread via mosquitoes all over the country, which would in turn affect other Central American countries as well. Ever since April 2015, Zika has spread all across South and Central America, as well as the Caribbean. In January 2016, the CDC issued a Level 2 travel alert for all people traveling in these regions. Zika still exists today and is most popular in Brazil and Western Africa. The Zika virus can spread through a multitude of ways. Zika is transmitted primarily through the bite of an infected Aedes species mosquito. Mosquitoes become infected when they feed on a person already infected with the virus. Infected mosquitoes can then spread the virus to other people through bites. Due to their large population, mosquitoes can easily become infected and spread the disease to many humans. The virus can also be passed through sex. A person infected with Zika can pass the disease onto their partner through semen and vaginal fluids. Zika can still be passed on even if the infected host does not show any symptoms of the disease. It has been found that Zika lasts the longest in semen of all bodily fluids. Perhaps the most obvious and dangerous form of transmission is from a mother to her child. A pregnant woman can pass the Zika virus to her fetus during pregnancy. Zika is a cause of microcephaly and other severe fetal brain defects. A pregnant woman already infected with the Zika virus can pass the virus to her fetus during pregnancy or around the time of birth. The Zika virus has been found in breast milk, and there have been several reports of babies being infected from breastfeeding. However, there have been no reports of symptoms for babies infected this way. Because Zika is not tissue or host specific, every human has the same chance of getting infected. Pregnant women are at risk, however, to spread the disease onto their children. Symptoms for regular adults include fevers, rashes, headaches, and conjunctivitis. As of today, there are no medicines or vaccines for the Zika virus. However, there are preventive measures one can take. These include covering and protecting yourself from mosquitoes, removing excess water, keeping mosquitoes out of your home, avoiding them at all costs, and using condoms for protected sex. The spread of the Zika virus in the last few years has shocked the international community. With the disease spreading rapidly, some reports have shown that Zika has infected over 1 million people in Brazil alone. Research is being conducted to create medications to combat this disease. Zika has made a major impact on the health of humans all across the world. The question still remains, is there any way we can stop this virus?